Hi Nikki, how are you today?
I'm good, how are you?
Good. So right away I'm noticing you're very tense. So let's kind of relax our body. Let's roll our shoulders back, kind of hang our arms down a little bit, and kind of relax your neck. Good. I just want to get you prepared for the session because we're going to be doing a lot of work. And our main focus today is that vocal hyperfunction. And as I talked to you a little bit about in our evaluation, that hyperfunction can also be created from tension elsewhere in our body. So we'll be targeting that hyperfunction and aiming at reducing that tension in the back of your throat, your neck, and in your head through a therapy today known as resonant voice therapy. The focus of this therapy is to get a change of our focus from that tightness in the back of our throat to a more forward focus and vibration in our lips. That's how we really want to focus on relaxing, and when we're kind of having that forward focus, we're going to be relaxing our muscles and not tensing our larynx. Because with the hyperfunction, your larynx is often really high up, and we want it to be in a lower position. In addition to your vocal folds are very constricted, and it makes it very hard for them to vibrate appropriately and effectively to where you're having a voice that is relaxed, a voice that's not fatigued. And you've said several times that you fatigue very easily, and you're tense. Your vocal folds feel tense, and you're tired by the end of the day. So through this, we want our vocal folds to be in an easy adducted or open position, and not pressed together or hyper adducted for phonation. So we're going to try some things today. So we're going to try to minimize that tension in the laryngeal area, as well as tension within your neck and also your face and your mouth. So let's just begin by just loosening up, just kind of relieving that stress a little bit. Good. And again, probably just putting your shoulders back and just don't feel like you have to sit up during therapy. We're going to have fun time together today, kind of be a little bit silly. And we want to focus our breathing to be breathing abdominally with our abdomen. So let's get started. So as we begin this first exercise, I really want you to pay attention to sensations in the front of your mouth and vibrations up here. So I want you to place your fingers right here by your nose and produce an easy Good. And remember, just be thinking about a more forward voice. Good. Any vibration? How does it feel? Good, good. And where do you feel that vibration?
Like all in the front of my face.
Yeah, and in your lips.
Yeah, you can feel it a little bit.
Right, and that's our goal today. We don't want that vibration being back in our throat, in the back of our mouth. And you're not, when you're phonating like this, you're still having an effective phonation, but you're not pressing your larynx so tightly together. You're still getting that clear tone. Okay. Now I want you to do we're going to kind of glide on the hum. So,
So you want me to
you can if you want, if that helps you.
So,
Good. Are you still feeling that forward focus? Yeah, and you're really focused on getting that. Good. Now we're going to do it, go from soft to loud, and this one is a little bit harder. So you can try that now. Good. So now I want you to hum with tightly pursed lips. So really put your lips together. And where are you feeling that vibration? Is it more towards the back or the front?
I think towards the back.
Yeah.
It feels more towards the back.
And does it feel tight?
Yeah.
Yeah, let's try that again. Good. So that's not what we want, obviously, because we want to get that more forward focus, but I want you to be mindful of what is that good focus, that forward focus, and what is that focus that we don't want. Now we're going to just have like loose lips, so and just very relaxed. And where do you feel the vibration there?
Towards the front again.
And you're nice and relaxed, and I can
Right,
just see that in your shoulders as well. Good. Remember again, the goal is to keep the vibration in the front of our face. Now we're going to hum with our teeth clenched, but when we clench our teeth, we're going to close our lips. And as we're doing that, it's not as comfortable, is it?
It's tiring.
It's tiring, it's fatiguing, and if you're phonating using this back clenched, tight larynx, you're going to be tired, like you said. So now let's close our mouth and keep our lips apart. And how did that feel?
Much more relaxed.
Yeah, and your vibration is, are you feeling it in your lips and in the front? Good. Before we finish today, let's start phonating with the use of some words. So we're going to hum with a vowel. So let me do it first. Remember to keep that forward focus. That one sounded more, it was in the back. Was that harder for you?
Yeah.
Yeah. Good. So before we go, let's do a few short words now. So, money, money, mother, mother, more. Good. Now we're going to do some phrases. I guess those were words, but we're going to do phrases now. My money, my money, and one more. More and more, more and more. Good. So for this next week, at least 3 times a day here, this is for you. When it's best for you, I want you to try some of these loose front focus exercises that we worked on today. Remembering to relax your muscles to start, kind of pull your shoulders back a little bit, loosen your arms up a little bit, and then hum with that more forward focus and really focus on reducing that tight larynx. And you will find that if you do this in the morning, kind of relax, maybe during the day, when you go to talk, you will be less fatigued. So do you have any questions for me?
No, I think I'm good.
So I will see you next week.
Yep. Thank you. All right, thanks.